Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio. We'll be speaking with Dr. Deepak Bhatt. He's joining us here, director of Mount Sinai Heart and principal study author. He's going to talk about the final data set from the Phase 2 ENTRIGUE trial. Welcome to Health Professional Radio, Dr. Bhatt. Thank you so much.
Great to be with you.
Well, as director of Mount Sinai Heart, give us a brief look into your professional background, and then let's talk about this final data set.
Absolutely. Well, I'm currently based in New York City, where I'm the director of Mount Sinai Heart and the Dr. Valentin Fuster Professor of Cardiovascular Medicine. I moved here several months ago, having spent about 15 years in the greater Boston area in the Mass General Brigham and Harvard Medical School system.
As far as the ENTRIGUE trial goes, what company conducted this trial?
This trial was sponsored by 89bio.
Okay, 89bio. And do you play a role at 89bio?
I was the study chair for the ENTRIGUE trial. This work was published in Nature Medicine, obviously a very prestigious medical journal. And what was published was the results of the ENTRIGUE trial. So ENTRIGUE is a Phase 2 trial. It is a gold standard type trial. By that I mean it's double-blind and randomized. It consisted of 5 arms, basically 4 different doses of the study drug called Pegozafermin, as well as a placebo. So we examined these 5 groups in patients with severe hypertriglyceridemia. By that I mean triglycerides in the range of 500 milligrams per deciliter to 2,000 milligrams per deciliter. So really high levels of triglycerides. And patients were treated in this double-blind randomized fashion for 8 weeks.
Was that the only condition that with too many triglycerides in your blood? Was that the only condition that was studied?
Yes, this is a trial of patients with severe hypertriglyceridemia. And this condition, as your audience is aware, is one that predisposes patients to pancreatitis, that is inflammation of the pancreas gland, and that's a very serious condition. And it's believed that lowering triglycerides lowers that risk. And part of the purpose of this trial was to see the effect of this drug, Pegozafermin, and the type of drug it is a long-acting glycopegylated analog of human fibroblast growth factor 21, or FGF21 as it's sometimes called for short, to see whether this novel drug would reduce high triglycerides. And in part, that's in the hope that reducing high triglycerides reduces that risk of pancreatitis, but there are also potentially other beneficial effects of reducing high triglycerides, some of which I'm sure you and I'll get into in a little bit.
Well, give us a cross-section of the study participants, ages, gender, things of that nature, and whether or not the results were significantly different in one test group as opposed to another.
So the study group was one that is typical for folks with severe hypertriglyceridemia. The average age was a little over 50 years. About 75% were male, for example. The average body mass index was 33, so on average, obese patients, again, as is commonly been noted for patients with severe hypertriglyceridemia. Almost half or so had type 2 diabetes. So a very typical patient population for those with elevated triglycerides, and a very representative population. And as I said, the purpose was to see if this drug, this novel mechanism of action, would in fact lower triglycerides. And indeed it did. There was a very significant reduction in the triglyceride levels with the Pegozafermin doses that were studied versus placebo. On average, if one looks at all the different doses of Pegozafermin we studied, it was almost a 60% reduction in triglycerides with the drug versus about 12% or so with the placebo. So a difference of almost 50% in terms of the percent reduction in triglycerides. So that's a pretty big effect size. And we studied a range of doses, but with the higher doses that we studied, well, it was even larger degrees of percentage reduction that what I was citing. So really substantial reductions in triglycerides, which one would hope would then reduce that risk that I mentioned of pancreatitis, but potentially have benefits in other organ systems as well.
What about any safety or side effects information in this patient population?
Terrific question. So we didn't observe any serious adverse events that were related to the study drug here. So that's very reassuring, with the caveat that this is a modest-sized phase 2 trial. In fact, there is an ongoing phase 3 trial that we're doing. That study is called ENTRIGUE, and that's looking at a larger number of patients also with severe hypertriglyceridemia. And as I mentioned, that trial is ongoing. It's a phase 3 trial, also rigorously designed, randomized, double-blind, placebo-controlled. And our hope is to enroll a bit over 300 patients and see if the results that we saw in this phase 2 trial, which were exceptionally strong in terms of the efficacy and very clean in terms of the safety, are replicated. So that study is ongoing and will be really important to see. But just from what we already know from the phase 2 trial, INTRIGUE, that we're discussing, beyond the effects on triglycerides that I just mentioned to you, that was the so-called primary endpoint of the trial. There were a number of secondary endpoints that we examined that also had beneficial effects, things like seeing significant decreases in apolipoprotein B, which is believed to be a marker of cardiovascular risk, so good to see reductions in that. And another thing I'll mention, other than just changes in blood tests and blood biomarkers of that sort, was that in a subset of the patients, we did MRIs of the liver, looking at the amount of fat in the liver. And these pictures, these images are in the paper in Nature Medicine. And the effects really were quite dramatic. I presented these data as a so-called late-breaking clinical trial at the European Society of Cardiology some time back. And I must say the audience was really amazed when they saw the pictures. They certainly thought the reductions in triglyceride levels were impressive, the sort of percent reductions I was mentioning. But when they saw the pictures, well, as they say, a picture's worth 1,000 words. And just over the course of this 8-week trial, a relatively short duration of therapy for seeing effects on liver fat, we saw very significant reductions in liver fat. So beyond just the effect on triglycerides in this patient population, we were seeing what in clinical practice should manifest as very significant benefits on the liver. Furthermore, this study underscored the fact that patients with severe hypertriglyceridemia have a lot of fat in their liver. And even though that might sound kind of obvious now, that was previously underappreciated, that patients with severe hypertriglyceridemia essentially many times are running around with subclinical liver disease. Mm-hmm. And along those lines, you'd asked before what the population was, and while in this study the population was severe hypertriglyceridemia, there was another phase 2 trial of the same drug, Pegozafermin, again an FGF21 analog, in patients with liver disease. So a study specifically in patients with biopsy-confirmed NASH. And NASH just refers to a particular type of liver disease, non-alcoholic steatohepatitis. And that work was published in the New England Journal of Medicine and independently showed significant benefits on liver.
Is there anything that you'd like to add? And then give us a website where our listeners can learn more.
Well, if they want to know more details of this, I would recommend that they go to the Nature Medicine website, where they can get a copy of the paper and get all the details, including the really great images that I mentioned, as well as the New England Journal of Medicine website for the other study that I alluded to.
And I do believe some more information can be found at www.89bio.com. Is that correct?
Yes, that's the company's website, and they'll have some details about both of these studies, the links to the journals, and some information about the ongoing work.
Dr. Bhatt, I appreciate your time. Thank you so much for joining us here on Health Professional Radio.
Wonderful being with you. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Deepak Bhatt. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.